All right, hi guys, how are you guys today? We are going to be going over chapter 2, okay, which is action at an emergency. But before we get into that, let's go over a few things for the end of this week. For those of you that were not able to make it to class on Monday, please email me so I can go over the notes and everything with you guys separately so you are all caught up. We basically just went over the syllabus, went over chapter 1, which is very, very simple. If you look at the notes and go over the reading in your book, you should have no problem. Let's remember that we have to be working on chapter 1 quiz, and then after today, we'll be working on chapter 2 quiz. Make sure you guys reference the due dates on Blackboard. I will send a message out after this is up and running on your Blackboard and let you know when those quizzes are due. As a reminder, you have 3 attempts for each quiz. Okay, so there's really no reason that you guys shouldn't be doing very well on this. Just remember, once you sit down to start the quiz, you cannot stop it. Okay, so each quiz is 20 questions. You get 60 minutes. There's no reason you guys shouldn't be able to do it. If you go in and you find out you didn't get the score that you wanted, go ahead, you can take it again. Let's just remember that these are good, easy points and a way to get you prepared for the exam that will be coming up after a few of these chapters. If any of you have questions about any of that stuff, please make sure you guys reach out. I know this is a little bit unconventional. We're online. I am not the best person with all this technology, so bear with me if the Zooms for some reason aren't working. If the recording didn't work right, I will get it all up for you guys. I will accommodate if I goof it up, and we will just all go from there. Okay, I'll try to keep this as short and sweet as possible because this isn't crazy information yet. This is all just kind of informatory stuff. And before we get into the nitty gritty, once we do skills assessments and things like that in October. Okay, so moving right along, we are talking about action at an emergency, what you guys as first responders would actually do in case you were ever dealt or you ever were involved in an emergency or you were that bystander. Okay. All right, so emergencies are, okay, they're dangerous, okay? A lot of them can be dangerous, some of them may not. It depends on the severity of the actual emergency, okay? They're unusual and rare. Very rarely are 2 emergencies going to be the same. They're all dependent on the actual situation. They're all unique. They're different from one another, same thing. Okay, they're all unique. It's going to depend on the circumstances. It's going to depend on what the injury is. It's going to depend on location, all sorts of things like that. They're unforeseen. They're not something that we know is going to happen. Okay, that's why it's called an emergency. Okay, whether it just be a sports injury, whether someone hurts themselves walking down the street, car accident, anything along those lines, heart attack, things like that. But all emergencies are urgent, okay? So if we have an emergency, someone needs to act, we need to know what the next step is and whether we need to call EMS or not, okay? Bystanders are of the vital link between EMS and the injured person, okay? You guys would be the bystanders. You are the ones that are recognizing the emergency and then knowing what's next step that you need to take. So first, you obviously need to recognize the emergency, see what happens, decide if it is an emergency, first of all. If it is an emergency, what your next step would be. Then you need to make sure that you decide to help, okay? Whether you're going to help, whether you're not going to help, whether you need to call EMS. And then you also have to check on the injured person or the ill person, and then your final step would actually be to administer that first aid, okay? Bystanders are oftentimes less likely to help in public places. This could be for a certain number of reasons, okay? Possibly they lack knowledge, okay? They might not be confident of their abilities. They're uncertain if they can help or what the right course of action is. They can also be confused about what the emergency is. That means they know that maybe it's an emergency, but if you have someone, if you notice a car accident, that's actually something that you see happening and you can know, hey, this is an emergency. That is going to be very different than someone who is having a heart attack. Okay, a lot of the times having a heart attack, there might be symptoms that you might not be able to tell whether they're really having a heart attack or maybe they're just having chest pains or like heartburn, things of that nature. So sometimes these things are a little bit harder to differentiate between each other. They're also influenced by others. Even if you guys don't think you are influenced by others in an emergency or whatever it may be. If you witness that emergency and no one else is helping, you may feel as though you shouldn't help. Okay, so these are all reasons why bystanders might not want to help out in public places. Okay, the quality of help provided by bystanders can be inadequate or dangerous. Okay, this is very true because sometimes we as bystanders can make poor decisions. Okay, or sometimes things are outdated or unproven first aid procedures may not be used. So an example that I can think of long time ago, if you had a nosebleed, they might have taught you to pinch your nose here and tilt your head back. Okay, that is not something that we do anymore because you can choke on the blood, but these are the things that I mean that possibly you may not know exactly the right decision to make or the way to administer first aid. Hence, you guys are going through this course so we can all be on the same page. Okay, what should be done when you recognize an emergency? Okay, there is a table 2.1 in your book. Check that out. It has an entire list of how to recognize an emergency and how to differentiate between the other ones. Okay, throughout this entire course, you guys, referencing your book is going to be important because there's going to be more information in there, and especially if you are a visual learner, to see those charts and to place it out than rather me just speaking to you. Okay, so when you are recognizing an emergency, you have to recognize the severity. Okay, is it life-threatening or is it something like an ankle sprain that can take a little bit you can be a little bit more reserved with, okay? Physical distance, how far are you from this emergency? Is it happening to you right here? Do you have to travel a great distance to get to it? Things of that nature. Relationship, do you know the person that this emergency happened to? Okay, that's going to influence your behaviors a lot. Time exposed, how long you have been exposed to the emergency. Okay, scene conditions, this is going to be a big one. A little bit different if someone falls down and rolls their ankle in the hallway of your building or your house, whatever it may be. The scene conditions there are very stable. Nothing is life-threatening. However, say there was a storm that rolled through and a power line fell down on a car, the person in the car is injured, the power lines are down. This is a very active and dangerous scene because there might still be electricity going through those power lines. So these are all going to affect the actual emergency. And also the person's appearance, okay? Might seem a little bit goofy, but if you see a person, if they are obviously seeming calm, they're okay, then you might respond differently to that as opposed to, say, somebody is bleeding or they have vomited, there's fluids on them. All these types of things are going to affect what you should be doing in that situation. Okay, next step, you have to decide if you want to help. This is a big one. Okay, I know we kind of talked about this in class on Monday. Okay, so you have to appreciate the importance of bystander help. Bystanders are the first ones that are going to see the emergency. Okay, they're the ones that decide if it's an emergency. Most of the time, they're the ones that call EMS and put all of this into effect. Okay, you have to feel confident enough helping. If you're going to help someone, you have to know, hey, I can help this person. You have to go into it with that confidence. You can't be reserved. You can't be scared. Okay, you have to be willing to take the time to help. Like we talked about, if you commit to helping somebody, you have to help them and you have to see it through. You can't abandon them. Remember, we talked about this being called abandonment in the last class. Okay, so if you commit to helping, you have to be willing to help and take the time to help. You have to know the potential risks of helping and keep those in perspective. Just because you are helping an individual does not mean that you are not at risk. Okay, so you have to weigh those risks and figure out if that's something that you want to do. You have to feel comfortable taking charge. Okay, so if you're the one that recognizes the situation, you have to be able to go into that situation and say, hey, this is what you're doing. Hey, you need to go call 911. I need help with this. Those sorts of things, okay? And you have to feel comfortable about seeing or touching the other person. This is not something where you're gonna be able to just look at someone and say, hey, you need to do this to yourself. You actually have to be the one that is helping and administering first aid. So these are all things to think about if you decide to help. Okay, you may decide not, some people may decide not to help, okay? There are several reasons maybe they decide not to help. Helping can be harmful, kind of like what we talked about. Sometimes there isn't any risk to you as a first aid provider, sometimes there is a lot of risk to you as a first aid provider. If we have a situation where there is a car accident on a busy highway and you get out of your car to help, you have to assume the risk that there are still cars moving around you, and it's an active situation, okay? You also have to decide if helping is not worth the effort, okay? Most times I hope people do help, okay? But sometimes if you see a situation and you're scared and you know that that situation is going to be unsafe for you and you might be harmed or even killed, then you want to make sure that you take that into effect, okay? Helping requires advanced training and skills. Sometimes in a situation, like we also talked about this on Monday, there might be skills that you are not able to offer at that point, okay? Remember, we can't act out of the scope of our training and skills. It might be a situation where only EMS can help at that point, so all you can do to help is maybe call EMS and let them know what is happening, okay? Other reasons people might not decide to help is because other bystanders are not helping. Remember, we just talked about that as well. We are very influenced by what other people do, and if we're out in public and you see everybody just standing around and nobody's helping, a lot of the times that will influence our behavior and we might not want to help as well, okay? Next slide, what should be done? Okay, if you call 911 if EMS is needed. Most important, you guys, calling 911, okay? A lot of the times people may make the wrong decision and not call 911, they may delay it, okay? Or they may completely bypass calling EMS. You have to make sure you know whether you need to call EMS or not, whether it's a severe situation at the moment, or maybe it's not, but it could escalate into a severe situation. So you need to know whether you should call 911 or not. I always say err on the side of caution, call 911, okay? You need to check the injured or ill person, and then you need to give first aid, okay? Knowing when to call someone, or we just kind of talked about this, okay? You have to assess if the person's condition is life-threatening. Obviously, if it's life-threatening, then you immediately call 911. Could it get worse? Like I just said, could it escalate to something else? If you move the person, will it cause further injury? If you have to move the person and it would cause further injury, if you don't know how to mobilize a joint, something like that, if they have a broken bone and it may be protruding through the skin, then that is a situation where you would need to call EMS, because if you moved the person, it would cause further injury. Okay, does the person need EMS? And could the distance or traffic conditions cause delay? Okay, all things to think about. When it's immediate, to call transport necessary, okay? These are situations where you immediately call 911. You do not hesitate, you just call. Okay, so things like difficulty breathing. There could be many reasons why someone has difficulty breathing, but difficulty breathing is we are calling 911 immediately. Lasting chest or upper abdominal pain. Okay, this could be the cause of a lot of things, but if this is persistent and it is getting worse, you need to call. Okay, a fast heartbeat, this would qualify a heartbeat from 120 to 150 at rest. If a person has a fast heartbeat like that, immediately need to call 911. It could be the cause of a lot of underlying things. Okay, difficulty speaking, numbness or weakness in any parts of their body, sudden dizziness. Let's see, there's a bunch more. Confusion or changes in mental status. This could go into the lines of shock. If someone is in shock, you definitely need to call 911. Unusual behavior, difficulty walking, sudden blindness or vision changes, bleeding that will not stop. We should all know that bleeding that will not stop, and it's aggressive bleeding, EMS needs to be called. Remember, broken bones visible through an open wound, okay? If you transport this person, then you would cause more damage, so EMS needs to be called. Drowning, choking, severe burn, allergic reaction. You guys might not think an allergic reaction, but this is something where we do not know how someone's body reacts to allergic reaction, and we don't want them to go into anaphylactic shock, okay? So EMS needs to be called immediately. Extreme hot and cold body temperatures, okay? This could lead to other things, so you need to call EMS. Poisoning or drug abuse, okay? There is also a chart in the book, I can't remember which page it is, but I'll let you guys know, that has all of these listed and gives you a little bit more information about them. So you guys just know exactly what situations where you immediately need to call 911. Okay, sorry, forgot a slide too. So also things like sudden and severe headache and pain, severe persisting vomiting or diarrhea, coughing or vomiting blood, behavioral emergencies, or wounds requiring medical care. Okay, these are all pretty self-explanatory, but it's good to know and review these, because if you were actually faced in that situation, sometimes your mind works in goofy ways and you might not remember it. So make sure you guys look at these and engrave them into your heads. Okay. So calling 911 first. Okay. Many injured or ill people should be moved only by trained personnel. Okay. A lot of the times, if something happens, a bystander might decide that they are the ones that want to transport the person. You have to think to yourself, is this going to cause more harm? Like I've said before, when in doubt, call 911, stay with the person, let them transport the injured person. Okay, so EMS care can increase a person's chances of survival rate and recovery. Okay, and an EMS ambulance can get a person to the hospital more quickly. Okay, think about that. We're stuck in traffic. EMS can, obviously, they have sirens, they can get through, they can get the person there quickly. So when in doubt, you guys really need to call 911. Okay. Most communities do just allow you to dial 911 for emergency assistance. Okay. I'm not sure of any communities that don't, but it's always it's always a good idea to check just to make sure. A lot of areas now have enhanced 911, which means that when you call 911, they can tell what number you're calling from and whether it's from a landline or a cell phone. And sometimes if it's on a cell phone, they can track your location. That's dependent. I'll give you a funny story. I had a lacrosse tournament in Indianapolis a few weeks back, and my phone while I was driving randomly called 911. I have no idea why, but the point of this is I stopped the call, but they still ended up text messaging me. They knew where I was. They asked if I needed more assistance, all those types of things. So a lot of the times if the call comes from a cell phone, they will be able to track the general location that you are at, okay, and whether it's a landline or a cell phone. Okay, if you were to call EMS, okay, you were to call 911, remember to speak slowly and clearly. Okay, these are trained professionals, but you need to try to remain calm and speak as slowly and clearly as possible so that individual can understand you and assist with the help. Okay, you have to be ready to give the following information. So a person's location. If you don't know the exact address, look for street signs. Okay, so like an intersection. You can also denote certain landmarks around the person, all those types of things. The more information you give, the better for the EMS technician. Okay, your phone number and your name. So you're going to have to give your phone number and your name so they know who they're dealing with and they know how to get a hold of you. Okay, a description of what happened. Be as descriptive as possible. Okay, so you're going to have to say, someone was in a car accident. My friend fell off a ladder trying to get on the roof. Anything along those lines to give them all the information. You're going to also need to tell them the number of people needing help. In most situations, it's maybe just one person that needs help, but say there's a car accident, there are two cars, there's two individuals in each car, then you would need to tell them that's what happened. And also we have 4 individuals that need help. Okay, and also a description of the person's condition if you can tell. Okay, are they in serious condition? Are they not breathing? Are they not Are they unresponsive? If they're okay, if it's just an ankle sprain, they're stable, but this is what happened. Make sure you let them know everything about that person's condition that you can visibly see. Okay. Also, do not hang up until instructed to do so. The 911 responder will let you know when you need to hang up. Okay, sometimes they require you to stay on the line if it's not a severe emergency, things of that nature, but they will let you know when you need to hang up. Okay, important tips for regarding 911. Obviously, teach children when and how to use 911. Okay, you should not have children or anyone just randomly calling 911. Yes, it has happened before. Okay, if they do accidentally call 911, don't hang up. Okay, explain what happened. If you hang up, they're going to call back. They're going to think there's an emergency and they might send a cop or a policeman to the scene just to see what's happening. okay? It's always important also around children to add the EMS, fire, and police numbers to a list by your phone in case they needed to call and they don't know what it is. If they have that list, they can call, okay? A lot of times in emergencies, rescuers are going to respond in different ways, okay? And if you guys are ever faced with an emergency, you might deal with some of these things. So it's not unusual to have adverse physical reactions to an emergency. These are not situations we are normally dealt with. We normally deal with. So if this is what you witness and you help, you might feel some of these behaviors. Okay, so desensitization can be effective in eliminating fears and anxieties. It's kind of a way to desensitize yourself from the situation. This may not be an easy thing to do. Obviously, if you are trained in this more and you help more in these scenarios, or this is your active job, you learn how to do it. Some things that you could try to do are things they say sometimes singing a song in your head that is happy might sound goofy, but a lot of the times it takes your mind off of what is actually happening and allows you to perform the first aid duties that you need to do without getting stressed out and things like that. Okay. Also, you may experience things like post-traumatic stress disorder, PTSD. I know you guys have all heard about that. It's a feeling of being emotionally let down. You might be sad, depressed after something happened. If this does happen, there are a lot of people that you can talk about and things of that nature to get help. Just know that these are very normal reactions by the common person or the common first aid provider. Okay. All right, so if we get to a scene, it's called the scene size up. Let me see in my notes. I believe I wrote down, yes, on page 20, chart 2.2 has a whole list of what you should do in a scene size up. Okay, so think of 10-second scan of the area. Okay, you're going to use 10 seconds to look at the area. Okay, and make sure you're trying to figure everything out about the situation. Okay, so these are the things that you need to make sure that you ask yourself. Are hazards present? How many people are involved in this situation? What is wrong? What happened? And can bystanders help? So let's just take this picture on our screen, for example. Okay, so maybe this was a storm that rolled through and there is a power line down. Okay, if you are the bystander, you see somebody injured on the ground or in the car, you can then look at that and say that this is an active emergency, and you can look at it and say there is a hazard because this power line is down. We have to think to ourselves, if this power line is down and electricity is still running through it, we risk electrocution. Okay. You also have to look at how many people are present. So maybe if there was just one, you'd know there's one. What is wrong? Is the person stable? Can you see them? Are they responsive? Things of that nature. What happened, obviously, in this situation? Maybe a storm rolled through, okay? And can bystanders help? So in this situation, can we have bystanders help, okay? All things that you guys need to think about. As you approach the emergency, so this is how, a little bit more in detail what we would do if we approached a scene. So you approach the emergency scene, look for obvious hazards, just like we talked about, okay? Same thing if we are dealing with a car accident and it is on a busy highway, you're going to look for obvious hazards such as motor vehicle traffic still running through, okay? You try to determine the cause of injury or illness and determine how many people are involved, okay? Other things you need to think about as a first aid provider, okay? Disease precautions. Okay, so first aid providers must understand the risk of infectious disease. Okay, so a communicable, sorry, hard word to say sometimes, disease is a disease that can spread from one person to another. Okay, so there's a lot of diseases. We have things like HIV, hepatitis, even coronavirus, with what we're dealing with now, a little goofy to think about, but that is a communicable disease. It is a disease that can be spread from person to person. Okay, so there are standard precautions for this. So as a first aid provider, you are going to assume that all injured or ill people are infected and can spread an organism that poses a risk from transmission of infectious diseases. Most people are not infected and this will not happen, but you have to assume that it is, so you take the proper precautions. Okay, so in your book, it talks about how the CDC has So the Center for Disease Control has a whole list of things that we can follow. This should not be anything new to us, considering we are dealing with COVID right now, and you hear this all over the news. But if you guys haven't looked at it, and you go to the CDC website on COVID, it takes you through all the precautionary steps that we can take to keep ourselves safe and others safe, okay? So I encourage you to look at that, just because as we get into this, we're gonna have to talk about those things as well. So one of the things, obviously you guys should have all heard of this by now, hand washing, okay? Wash your hands before and after contact if possible. If you can't before, definitely after contact. It says use soap and water if possible, rub hands together for 15 to 20 seconds. I know you guys have all heard now 20 seconds. Okay, that's now what the CDC recommends, okay? So rinse and then always dry it clean, dry it with a clean towel, okay? Do not leave your hands wet, always dry them, okay? If you do not have soap and water, you can use an alcohol-based sanitizer if soap and water is not available. So you obviously want to apply the gel fully, so you can apply the gel all the way around your hands, not just on the pads of your hands, okay? And you want to rub them together through your fingers on the top, and you want to rub it until it is completely dry. That means that alcohol has worked its job to help with the germs, okay? You guys have probably also heard of PPE, personal protective equipment. If you hadn't, then you probably heard about it because we're dealing with COVID, okay? This provides a barrier between the first aid provider and the injured or ill person, okay? So PPE might be different for an actual first aid provider as opposed to an emergency room doctor. That emergency room doctor may have more intensive PPE. But one of the most common things are exam gloves, okay? We will be dealing with these exam gloves, and this might not be the only class that you're dealing with these exam gloves as well. Okay, so once we get into this chapter a little bit later and we do our skills assessments, you guys will actually learn how to take the gloves off, but there is a proper way to do it so you do not get infected with the germs and you also do not spread them. So if we're looking at this slide, someone has their hand like this and we're pinching the outside near the wrist, okay? You're going to pull it off, okay, and make sure you're turning the glove inside out, okay? Once we get to that, okay, as you see on the screen right here, they're bunching it up in the infected hand with the glove that's still on, and then you're gonna take your clean hand that has, the glove is off now, and stick 2 fingers underneath, okay, the dirty glove, and you're going to pull it out, okay, and turn it inside out, just like you see in this picture, okay? The first glove remains inside the glove that is just removed. Once you have removed this, you're gonna either throw it out in a biohazard container and sealed plastic bag, or a sealed plastic bag if you do not have the biohazard container, okay? We will practice how to do this in class, okay? So you guys can take a couple turns to get it right. It's a pretty easy concept, but it's not always the easiest thing to do. So this is why we need to practice, okay? Obviously, after you remove your gloves, you want to wash your hands, okay? So when in doubt, you're always washing your hands. That's one of the steps that we need to take, okay? So there's other personal protective equipment. So mouth-to-mouth barrier devices recommended when administering CPR. You guys will all get these in your packets, and we will show you how to use them. Eye protection, gowns, aprons, things of that nature. If you think about it, so personal protective equipment, we're all required to wear masks now when we go into public and we can't socially distance, okay? So that is also a form of personal protective equipment. So anything that is actually personally protecting you, okay? Cleaning up, when you are dealing with cleaning fluids, blood, anything along those lines, you wanna wear, if you have them, you wanna wear heavier gloves than light latex or vinyl gloves, okay? Latex and vinyl can rip, and also chemicals that you use to clean can strip through those gloves. So you also want to use absorbent barriers to soak up the blood and other materials first. So if you are cleaning up, you always want to soak up that material first. You don't want to put solution on it right away, because all you are going to do is spread the germs, the fluid, okay? So you're gonna after you do that, you're gonna clean the area with soap and water. Okay, once you've cleaned the area with soap and water, now you are going to disinfect using a bleach solution with water. So it's a 1 to 10 solution. So 1 part bleach, 10 parts water. Okay, so it's very, very diluted, okay? And once you are done with this, you want to discard the contaminated materials properly. You also do want to think about, if you are using a bleach solution, that it can get on clothes, stain it. If it gets on skin, it can also burn. So you have to be conscious of those types of things when you are cleaning up, okay? If you are exposed, if you are exposed to blood or body fluids, okay, you want to wash that contaminated area with soap and water. If you guys ever go into like a science lab or something and you get a chemical on you, there are actual emergency showers that you would go stand under. Obviously, this is not what we're talking about here, but it's kind of the same concept. So if you get blood or fluid on your hands, you want to wash that contaminated area with soap and water, okay? If this happens at work, you want to report this incident to your supervisor, okay? Always, always report it, because they're gonna have to do paperwork on it, and so it's all illegality, okay? If you've had exposure to blood or someone's body fluid, it's important to then contact your personal physician just so they can check you out to make sure that you are okay. If you are exposed for a significant amount of time, then this is definitely when you should seek medical care, just to make sure everything is all right, okay? Couple more slides, guys, and we'll be done. Okay, as morbid as this might seem to you guys to talk about, if and hopefully you are not ever faced with a first aid situation where someone is dying or is already dead, you are going to need to know how to deal with those situations, okay? So it's to indicate that everything that can be done to help will be. If you are dealing with someone that is dying, you want to let that you want to let that person know that you are doing everything in your power, and so is everybody else, to make sure that everything is happening. Oh, wait, I skipped a slide. So sorry. Okay. Okay, let's go back to this. Okay, so if you are in this situation, you want to make sure you are letting that person know that you are doing everything you can. Okay, in a situation like this, you want to avoid negativity, okay? Even someone that is unconscious can still hear what is going on around them. So you want to try to be as positive as you can and refrain from any sort of negative talk, okay? You want to assure the person that you will locate and inform his or her family. You don't want to give away personal information, but if this person asks what is going on with his or her family, if they're involved in the situation, or if they're the only ones that are involved in the situation and they want you to get a hold of their family, please reassure that person that that will happen, okay? You have to allow for some hope. Even if you know that there is not hope, okay, you have to give up the perception to this person that there is hope. You want to remain positive, okay? Do not volunteer any of this, do not volunteer information to others, okay? So do not let other people in the situation know what's going on. Make sure to stay private and be there for that person, okay? Offer as much as you can, simple, clear information if asked. If they ask you a question, be honest, be clear, but try to keep it simple. You don't want to overwhelm them anymore, okay? And obviously use a gentle tone and reassuring voice. This may be difficult to think about, but this is definitely something that is going to help the person calm down. So you want to use that gentle, reassuring tone and reassuring touch. Okay. If you are faced in a situation where you do deal with something like this and someone does die, or you're dealing with a dying person, there are a bunch of steps that you as an individual person or the people around you that have dealt with a family member passing away or a friend, anything along those lines, goes through a grieving process, okay? Your book delves a little bit further into this, so I encourage you guys to look at it just in case anybody was ever faced with this, but you will also need to know this for your exam. So the first step is denial. You can't believe this is actually happening to you. Anger, you're wondering why this is happening to you. Bargaining, you kind of make an agreement in your head that this is actually really not happening, or if you delay it, it's not going to happen. Depression is feeling sad and feeling despair about the situation. And then the final step is acceptance. You accept what has happened, but that doesn't mean that you are happy or anything along those lines, and you're going to need more support to get through this, okay? If you are interacting with survivors, okay, you want to leave. So in a situation, so let's just take a car accident, and someone in that car accident has passed away, but there is also a survivor. If you are dealing with that person, you want to leave the confirmation of death to the physician. You should not be the one that's letting them know that the other person in the car has passed away, okay? If survivors know that has happened, or they're dealing just with the situation, you have to allow those survivors to grieve. Okay. If they're crying, let them cry. If they're yelling, let them yell. Provide simple, honest, and clear information, just like you were. If you were dealing with somebody that was dying, be honest, be precise, but be very simple. Okay. Don't overanalyze it. Do not leave the individual survivor alone. This is an important one. Once you're helping that person, make sure you continue to help that person until somebody else comes along and helps you out. Okay. And then also use a gentle tone and reassuring touch. Okay. So this is chapter 2. I know these lectures may seem a little bit dry. Okay. It might just seem like blah information to you guys, but this is all the background that you are going to need to know as we get more into the nitty gritty. Okay. Please read over these chapters in your book. These chapters are very short. They're very easy read, but they're going to help you retain that information instead of just listening to me talk to you. Okay. So moving forward to next week, like I said, I will have a schedule for you by Friday or Saturday as to how next week will look. I am assuming we're going to have at least one live Zoom, if not 2, but I will let you know. For the time being, you guys should be working on quiz 1 and quiz 2. Those are on Blackboard. They should both be open now. If for some reason they're not, or someone is having issues with it, please let me know, and I will make sure that I get that taken care of. In the meantime, if you guys have any questions whatsoever, remember, please let me know, and I will help you guys out. We can always set up a live Zoom, or if you would prefer to meet in person, just let me know. We can definitely meet in person. Okay. Have a good rest of your day, and then I will see you guys next week.